A new report is out on the impact of concussions and the effect they're having on student athletes. Earlier, I spoke with an expert to find out more as part of this week's Raising Our Kids. The numbers are alarming. Concussion diagnoses, kids ages 10 to 19, rose 72% over the past 5 years. Joining us now with more on this new report, Dr. Rachel Aronow of the WESTMED Pediatric Group. Thanks so much for being with us, Doctor.
Thanks for having me.
Well, first off, does this significant increase surprise you?
Actually, it doesn't surprise me too much. I've seen the numbers coming out over and over again nationally, locally, about the increase in the number of concussions.
Well, tell me what you think about the fact that it's not only in New York, according to this report, but nationally this increase is real. Is this about more reports based on media attention? Why are we seeing these numbers?
I think it has a lot to do with media attention, but I think it's been a very positive thing because that media attention on the national level, looking at NFL players and chronic traumatic encephalopathy, but concussions in kids all over the place has drawn attention from the national medical organizations, from local schools, from parents, from children, and also among the doctors. I think because all this attention has come about, we're diagnosing it more, and we're seeing more people recognizing that this is happening and presenting for the care that they really should have been getting all along.
So patients ages 15 through 17 were the most likely to be diagnosed. And of course, parents of all ages of kids doing contact sports need advice.
Yeah.
So how do you approach that? Do you actually talk to them about it without having a concussion on their record?
That's a good question, actually. Definitely for children who are going to be engaging in certain sports where there's a really high risk of concussions,
yes.
kids who are starting playing football, hockey, soccer,
yes.
things where there's a lot of head trauma.
My daughter plays lacrosse, and she's 13, and there's no helmet there.
Right.
And while it is not necessarily a contact sport, it can be very, very physical.
That ball is hard and hurts a lot.
Absolutely.
It can definitely cause a concussion.
So what kind of advice in terms of prevention, what are you telling your patients?
Well, I mean, primarily when you're doing a known high contact sport, obviously you want to make sure you're using all the appropriate gear and listening to your coaches in terms of safety.
Yes.
But I think one of the main take-home point is that if you think you might have had a concussion, if you have a head injury, if your coaches are suspicious of you having a concussion, you have to stop playing. Despite your own pressure to continue, you're in the game, you want to keep going. It doesn't matter. And what's more important, and if you'll look at what the AAP and the CDC say about this stuff, it's better to miss one game than miss the entire season.
And what about if you've had a concussion? Would you ever say to a parent, you might want to think about not sending him or her back out on the field this season?
Yeah, and I think that that's a very important point because the pressure will not only come from the player, but from the parents and from the school.
Yes.
And I will tell parents that a concussion is special in that it's your brain that's been injured, but that in some ways you need to think about it like any other injury. Like, for example, if you had hurt your knee, you take the time necessary and the care necessary to take care of it, and if you start using it too quickly, you're going to take steps backwards in terms of your healing, and the same thing is true for your brain.
All right, well, really important information for concussion prevention. Dr. Rachel Aronow, thanks so much for being with us.
Thank you.